Torbay Chart Patient Decision Aids, a new generation of decision aid that will enable shared decision making. Have you actively participated in decision making about your health condition? When you take your elderly relative with knee pain to a healthcare professional, do they engage in a dialogue and discuss various options? How often are meaningful choices that you prefer or offered? SDM is a collaborative participation of patients with their healthcare professionals in choosing a treatment. No decision about me without me has been a mantra for over a decade now. Cochrane Review, GMC, NICE, NHSE Personalized Care Agenda, and legal requirements all recommend patients should be involved in their healthcare decisions. Well-informed patients choose less invasive treatments, and shared decision-making has been shown to reduce joint replacement uptake, save money, and improve post-operative patient-reported outcome measures. Although this is an ethical, moral, statutory, and legal requirement, active SDM only happens sometimes. Why is this the case? The knowing-doing gap, reluctance to change consultation style, perceived lack of time, and most importantly, lack of a practical standardized SDM tool may all be the reasons. Clinical decision support tools and patient decision support tools are the two faces of the same coin. However, a distinction needs to be made between clinician-facing decision support tools and patient-facing decision support tools. Clinical decision support tools mirror pathway documents and are generally rigid, following protocols and guidelines. They may introduce automation bias and rarely support choosing multiple treatments simultaneously. However, patient-facing decision support tools tend to have a conversational approach and are in an easy-to-follow format which the patients can understand. It allows the clinician to explain various options that are appropriate to a patient. Then, under their guidance, the patient can choose option or options that align with their values, risk-taking, and expectation. They are the best tools to move from evidence-based practice to evidence-informed practice, thus resulting in a personalized care. A tool to enable SDM is a patient decision aid or PDA. PDA is not just an information leaflet, but an intelligent collection and unbiased presentation of all possible treatments. Here are some examples of currently available PDA tools for managing knee arthritis. They tend to be text-heavy, uninspiring, complicated, impractical during consultation, and may provide options that may not be relevant to every patient. Hi, I'm Rangaraju Ramesh, a consultant orthopaedic surgeon with over 30 years of experience, and I have created a practical PDA tool called Torbay Charts for daily use. Torbay Charts helps one to navigate relevant treatment options. This tool has been peer-reviewed, critiqued by various patient panels, and presented at many conferences. The tool is organized in layers and begins with a panoramic dashboard that provides a drone view of the disease process with choices based on the disease stage. Each treatment spans a different width. Patients can choose treatment or a combination of treatments aligned with their values, expectations, and risk acceptance. It requires no changes in the consultation style and is quite intuitive. The tool can be customized to include any locally available treatment or other exemplar treatments. If required, an on-the-fly language translation can be enabled to serve people who do not speak English as their first language. Whereas Layer 1 gives an uncluttered, clear view of what is appropriate, the deeper Layer 2 provides detailed information about risks, benefits, burdens, and relevant references. Once appropriate options are shortlisted, they can be placed side by side and compared just like on a comparison website. Let us consider three scenarios. Patient A enters the pathway earlier, and the treatment options to consider would be more of self-management and simple intervention. One should not offer or discuss surgery as it is inappropriate for patient A. For patient B, who enters the treatment journey later, has more options, including surgical treatment. However, patient B may still choose non-operative treatment. Patient C, who is at a very similar stage as patient B, may still select different treatment combinations in contrast to patient B. This single tool can be used in both primary and secondary care, and it could serve as a passport for the patient when they move from one set of treatment to another over a period of time. A pilot study was done in 2018 through a QI project for 8 weeks. 107 patients seen in the ESP interface in Torbay Hospital returned the questionnaire with over 90% satisfied with Torbay Charts as an enabler of shared decision-making conversations. Clinicians found the consultation to be focused and not time-consuming. Over 50% of the patients chose non-surgical treatment. Notably, 5.6% of patients who came in expecting to be waitlisted for joint replacement surgery chose non-operative treatment. 2 years later, 1.9% of these patients were still satisfied with their choice. Our ESP sees over 1,500 patients in the OPD annually and places around 40% of the patients on a waiting list for surgery. If a sustained 2% long-term reduction is realized, we may be able to avoid waitlisting at least 30 patients long-term with a meaningful sustained year-on-year savings of over £250,000. Torbay chart is the best way to translate a clinician-facing pathway document into an easy-to-understand patient-facing decision support tool. It will support patients in making an informed choice about their preferred treatments. Torbay charts can be incorporated into pathways and will allow consistency at all levels, from primary care to secondary care, about the choices available for a patient. The best place to deploy this would be the first contact practitioner or extended scope physiotherapist interface. It will be helpful in primary care setting to direct patients to follow self-help options. In secondary care, it will allow the conversation to consolidate when surgical intervention is chosen and therefore allow one to demonstrate that a shared decision-making has taken place and thus leading to informed consent for an invasive treatment. At present, a complete set of tools for hip and knee arthritis is available. We have developed Layer 1 materials for other conditions in orthopaedics as shown. In addition, Layer 1 information has been developed for conditions in other specialties too. Torbay chart patient decision aids. Together, we decide. Please visit the website or watch the deployment video. Please contact us if you require any more information. Thank you.